Good evening, ladies and gentlemen, and thank you for joining us for this COVID-19 update. Of course, this press briefing is being brought to you by the Ministry of Health and, by extension, the Government of the Commonwealth of Dominica. Of course, following this weekend's lockdown, I'm sure that everyone has a little bit of anxiety going into this week. So that's why we're here to give you the information that you'll need to prepare for the week ahead. This evening, we have with us the Honorable Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Acting Attorney General, Mr. Lennox Lawrence, and we also have with us the Honorable Minister for Trade, Ian Douglas. Let's begin uncharacteristically with our Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre.
Good evening. Thank you for joining me for the latest update on the current COVID-19 situation in Dominica. As of today, August 8th, 2021, the total number of active cases of COVID-19 in Dominica is 179. As our contact tracing and testing continue, we have significantly boosted our testing capacity in order to contain the spread of the virus. Testing centers were set up at the Windsor Park Sports Stadium, and mobile testing was carried out in the villages of Maho, Mont Prosper, Point Michel, Campbell, Trafalgar, Layu, Portsmouth, Calibishi, Soufriere, Marigot, and other health centers as well. The strategy of increased antigen testing activities, which are ongoing island-wide, has resulted in us identifying the possible cases. This way, we can remove these individuals from the community, preventing interaction and further transmission of the virus. As many as 84 health workers have been trained to administer the COVID-19 antigen and PCR tests, which will assist with contact tracing. A testing initiative dubbed Know Your Status started on Saturday, 7th August 2021 and continued today, Sunday. This initiative will continue throughout the week on Monday, August 9th to 16th, to ensure that every hospital staff member is tested and cleared so that we can be confident of the safety of our patients, our hospital employees, and their families as well. Further to yesterday's update on the situation, 5 staff members last week returned positive antigen test. Of the 5, 1 tested PCR positive and is symptomatic and is currently at the COVID isolation unit. The other 4 are in government quarantine. 235 staff members of the hospital were tested on Saturday and Sunday through the initiative, and all have returned negative antigen results. This represents close to 50% of the total hospital staff. We are assured that the situation at the hospital is under control and will be monitored closely. While non-emergency type services have been suspended, services for people with life-threatening illnesses remain available, such as chemotherapy and hemodialysis. Members of the public are reminded that no visiting to the hospital is allowed until further notice. The Ministry of Health has also conducted testing of 3 inmates at the state prison in the interest of the safety of employees and inmates. All 3 tests returned negative results. I wish to remind the public that visitation to the state prison is suspended for the duration of the curfew order. As a further precautionary measure, the Ministry of Health will be scheduling testing at the state prison this week for staff as well as inmates. Currently, we have all the resources necessary we need for continued testing of our citizens. The Ministry of Health is in possession of 12,000 PCR tests and 13,000 antigen tests. We expect 12,000 more antigen tests to arrive on Wednesday, August 11th, and another 10,000 by Friday, August 13th. Additionally, 10,000 antigen tests are presently on order. To facilitate the increased testing and contact tracing, several teams of doctors, nurses, health aides, and other support staff are working together to stem the rate of transmission, which we are seeing. These teams are working across the island since the outbreak and have devoted long hours to the process. We have also increased staff at the Ministry of Health, including employment of 27 registered nurses and 8 doctors. Nurses and doctors have also been recalled from their leave. The entire state machinery is engaged in this national emergency, including all ministers and senior public officers, permanent secretaries, and other public officers who are offering specialized service in areas such as statistics and ICT and support at the testing centers. In addition to the specialists stationed at the St. James COVID Isolation Center, we have also established a consultative group of medical specialists. This group of consultants will provide support on management of COVID-19 cases on a 24-hour basis. We are pleased with the leadership and efforts of the police since the start of the COVID-19 pandemic. The officers of the Commonwealth of Dominica Police Force have responded with commendable spirit and commitment to the task of protecting our nation. We are grateful for their effort. We also thank the first responders of the Dominica Fire and Ambulance Services who are on the front line of this pandemic. As we work speedily to arrest the surge in cases, our firemen and ambulance drivers are responding to potential coronavirus cases 24/7, and their task is not an easy one. They need our support and cooperation. I thank the Chief Medical Officer, the Director of Primary Healthcare, the Principal Nursing Officer, and the District Medical Officers who are providing leadership through this process and working around the clock to stop the transmission of the virus. The nurses, the lab superintendent, and staff at the lab who are putting on long hours to return timely PCR results. Those manning the quarantine centers, security officers, drivers, cooks, and the many others who are working conscientiously, and they deserve our highest praise and commendation. A mask mandate remains in effect and will be fully enforced at all times. Other protocols that may be adhered to include physical distancing of at least 6 feet in public and the avoidance of crowds. There may be absolutely no congregating. You are encouraged to wash your hands often with soap and water for at least 20 seconds, particularly after being in a public place or after coughing or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 70% of alcohol, and avoid touching your eyes, nose, and mouth. Practice safe respiratory etiquette. Always cover your mouth and nose with a tissue when you cough or when you sneeze, or use the inner side of your elbow. Dispose of all used tissues in the trash. Clean and disinfect frequently touched surfaces daily, including your desk, phones, toilets, faucets, and sinks. Please, if you have no reason to be outside, stay indoors. You should not allow people who don't reside at your home to visit you, and vice versa. These measures are absolutely necessary for your safety and the protection based on the current situation. The virus is a fast-spreading and very contagious. It is not a joking matter. Therefore, it is important you remain vigilant and practice all safety protocols to protect your health and that of your loved ones, your neighbors, and the community as well. So far, we have seen a steady flow of people coming to get tested. We commend and thank you for this decision to take responsibility for your health and the safety of your family, friends, and loved ones. Presenting for testing if you feel you have been exposed is the responsible action to take, and it will help us get this situation under control much quicker so our country can return to normalcy much faster. If you have flu-like symptoms, please call your district nurse or the hotline. The numbers are 448-2151, 448-2171, 448-2156, 611-4325, or 1-800-219. One of the most effective measures you can take to ward off the virus is to get vaccinated. As we have noted, 90% of the symptomatic patients at the COVID facility are unvaccinated. This reinforces our conviction that vaccines act as a line of defense and can keep you from getting seriously ill if you become infected. The vaccines have been thoroughly tested and found to be safe and effective in preventing severe COVID symptoms and illness. On Thursday, 5th August, we received 12,000 AstraZeneca vaccines from the government of the United Kingdom. We are making vaccines available for every Dominican citizen, 18 years and over. I urge you to visit the main health centers in each district to get vaccinated. As the government, we are confident we have the capacity to bring this latest threat to the health of our nation under control. However, we need the cooperation of every single Dominican in this endeavor. Together we can do this. I urge all citizens to join in the national effort to contain the spread of COVID-19. We humbly ask for your support. Presently, as I'm addressing you, a team of doctors, Dr. Yudi Ferrer, just left Trafalgar in this weather to go to Loda to continue testing. And Dr. Nesty just left Point Michel with her team of nurses and community health aides and support staff, the driver, to go all the way to Galio to continue testing. Dr. Favre Drago has been at the stadium from morning for the past few days, every day, testing with her team of community health aides, her nurses, her support staff. Dr. Burnett, all the way in Campbell as we speak, testing is ongoing. The least we can do to show appreciation for this hard work in medical teams is to just adhere to the guidelines. We're in a state of crisis, and we can only do it if we come together. Let us follow the guidelines. Let's avoid these mass gatherings. Let us wear our mask. Let us wash our hands regularly. Let us just follow the orders. The curfew orders are there. Let's stay indoors. Let's not congregate. We are doing it for ourselves. We are doing it for our countries. So we are pleading with you. The government is playing its part. The system is playing its part. You must play your part. Let us do it collectively, a collaborative effect. I thank you.
And thank you so much to the Honorable Minister for Health, Wellness and New Health Investment, Dr. Irvin McIntyre. I'm sure everyone could hear the emotion in Dr. McIntyre's voice because this becomes very personal for everyone involved in this COVID-19 fight. Everyone involved in the contact tracing, the testing. It's not easy to leave your families, leave the safety of your own home to do what is necessary for the safety and well-being of our country. Again, you heard that we have 179 active cases. Ladies and gentlemen, this is not a sign of doom and gloom. Rather, it is an opportunity to prove just how patriotic we are by doing what it takes to protect those we love most right here in Dominica. We welcome next this evening the Acting Attorney General, Mr. Lennox Lawrence.
Good evening, everyone. The Honorable Minister for Health has updated us on the current situation with respect to COVID-19 in Dominica. To limit the spread of the virus, it became necessary to impose restrictions on movement of persons on island. Therefore, the following curfew orders and amendments were passed and others are being proposed. On 3rd August 2021, His Excellency the President issued the Emergency Powers Curfew Order number 19 of 2021, which applied to the entire state of Dominica. I will refer to this order as the principal order later in this address. Under Section 4 of the order, the curfew was imposed throughout Dominica from 6 p.m. on the 3rd day of August 2021 to 5 a.m. on the 10th of August 2021 as follows, and I would read, a curfew is hereby imposed throughout Dominica from 6 p.m. on the 3rd day of August 2021 to 5 a.m. on the 10th day of August 2021 as follows. A person shall not be out in a public place between the hours of 6 p.m. and 5 a.m. on Mondays to Friday. B, a person shall not be out in a public place between the hours of 5 a.m. to 6 p.m. on Mondays to Friday except to provide or access essential services. And C, a person shall not be out in a public place from 5 p.m. on Saturday to 5 a.m. on Monday unless the person is an essential worker or has a written authorization from the Commissioner of Police. It must be noted that this was not a total lockdown, but it provided for several exemptions. Section 5 of the curfew order made provisions for the following exemptions. And I read, Section 5.1, a person is exempted from the prohibition on being in a public place during the period specified under Section 4 if he is A, a person who is the holder of a written authorization under Section 4C, B, a person who is in the public place for the purposes of 1, traveling to or from work as a service provider or essential worker, 2, seeking urgent medical care, 3, shopping for necessities, 4, conducting a banking transaction, 5, caring for a family member, pet, or livestock, 6, engaging in construction and manufacturing, and 7, traveling to or from the airport or seaport. On the 6th of August, 2021, the Emergency Powers Curfew Amendment Order was gazetted. The purpose of the amendment was to provide for Saturday, 7th August, 2021, among other matters. Section 3 of the amendment order amended Section 4 of the principal order as follows, and I would read Section 3. The principal order is amended by deleting Section 4 and substituting the following provisions. 4. A curfew is hereby imposed throughout Dominica from 6 p.m. on Tuesday, the 3rd day of August 2021, to 5 a.m. on Tuesday, the 17th day of August 2021, as follows. A person shall not be out in public or in a public place between the hours of 6 p.m. and 5 a.m. on Monday to Friday. B, a person shall not be out in a public place between the hours of 5 a.m. to 6 p.m. on Monday to Friday. And C, a person shall not be out in a public place between the hours of 6 p.m. on Friday to 5 a.m. on Monday. Effectively, this amendment order is still in force. Again, it must be noted that this was not a total lockdown of the country as some persons have alleged. There were also several exemptions in the order, and there were several instances where the prohibition did not apply. For example, Section 4 of the amendment order amended Section 5 of the principal order and provided as follows, and I read, the principal order is amended in Section 5 by A, deleting subsection 1 and substituting the following. The prohibition under Section 4A does not apply to an essential worker, a person who has a written authorization from the Commissioner of Police, C, a person seeking urgent medical attention, and a person accessing COVID-19 testing. And the Section 1 prohibition related to the prohibition to be out in the public from 6 p.m. To 5 a.m. Mondays to Fridays. In subsection 2, the amendment reads, Section 4B does not apply to a person who is in a public place for the purposes of A, providing or accessing an essential service, B, caring for a family member, pet, or livestock, and C, engaging in construction and manufacturing. And the prohibition with respect to Section 4B essentially read was a prohibition to be in a public place from 5 a.m. to 6 p.m. on Monday to Friday. So there were exceptions to that particular prohibition. A further amendment of this order is proposed for tomorrow, which will bring the amendment of the 6th of August to an end on Tuesday, 10th of August 2021, as opposed to the 17th of August 2021. Because as we would have noticed, as I read earlier, the amendment which is in force now goes to the 17th of August, but there is a proposal, a recommendation for having that amendment to be effective only to the 10th of August 2021. Effectively, therefore, a new curfew order is being proposed from Tuesday, 10th of August 2021 to Tuesday, 17th of August 2021. Therefore, the curfew does not come to an end on Tuesday. What happens, the existing amendment will come to an end on Tuesday, and a new curfew order is being proposed from Tuesday, the 10th of August, to Tuesday, the 17th of August, 2021. It is intended that this new order will expand the areas of exemptions to include persons collecting their Social Security payments, renewal of insurance policies, purchase of vehicle spare parts, and also delivery services for groceries, fisheries, medicine, and things of that nature. This proposed amendment for tomorrow will clarify all the concerns raised by some in the public, and also is intended to extend the categories of exemptions. For example, Section 3 of the proposed amendments is intended to amend Section 4 of the principal order and is expected to read as follows. A curfew is hereby imposed throughout Dominica from 6 p.m. on Tuesday, the 3rd day of August 2021. Let me just read the correct one, if you may excuse me. So it should read, a curfew is hereby imposed throughout Dominica from 6 p.m. on Tuesday, the 3rd day of August 2021, to 5 a.m. on Tuesday, the 10th day of August 2021, as follows. So the intended or the proposed amendment to be effective tomorrow would take the existing curfew order to Tuesday, the 10th of August 2021. And the curfew hours would be as follows. A person shall not be in a public place between the hours of 6 p.m. and 5 a.m. on Monday to Friday, unless the person is an essential worker, is seeking urgent medical care, is accessing COVID-19 testing at the testing area closest to their place of residence, or has a written authorization from the Commissioner of Police. B, a person shall not be out in a public place between the hours of 5 a.m. to 6 p.m. on Monday to Friday, except as provided for under Section 5. And C, a person shall not be out in a public place between the hours of 6 p.m. on Friday to 5 a.m. on Monday, unless the person is an essential worker, is seeking urgent medical attention, is accessing COVID-19 testing at the testing area closest to their place of residence, or has written authorization from the Commissioner of Police. So the proposed amendment would be worded differently and would indicate the exceptions within the initial provisions. That should clarify the issue much easier, and the concerns raised by persons about a total lockdown, I think, will be dealt with, as the prohibition itself would indicate what the exemptions are. Additionally, the proposed exemptions are intended to go a bit further, and I would read another provision which would be of interest to several persons. In Section 3.2, which provides that notwithstanding subsection 1, which as I said, is amending Section 4 of the principal order, on Saturday, the 17th of August 2021, a person shall be allowed to be in a public place as follows: between the hours of 10 a.m. and 1 p.m. to provide services at and to access grocery stores, pharmacies, and supermarkets, and to provide services at and access a gas station at Roseau, Portsmouth, Canefield, Marigot from 10 a.m. until 4 p.m. And subsection 3, notwithstanding subsection 1, on Sunday, the 8th of August 2021, a person who is an essential worker, is seeking urgent medical attention, is accessing COVID-19 testing at a testing area closest to their place of residence, or who has written authorization from the Commissioner of Police, shall be allowed to be in a public place to provide services at and access gas stations from 6 a.m. to 4 p.m. Additionally, Section 4 of the proposed amendment is intended to amend Section 5 of the principal order and is expected to read as follows. The principal order is amended in Section 5, A, by deleting subsection 1 and substituting the following. A person is exempted from the prohibition of being in a public place during the period specified under subsection Section 4.1b if he is a person who is the holder of a written authorization from the Commissioner of Police, B, a person who is in a public place for the purposes of 1, providing or accessing an essential service, 2, caring for a family member, pet, or livestock, 3, engaging in construction and manufacturing, and C, in the case of a person who is an attorney at law, traveling to and from his law office, provided that the law office shall remain closed to the public. So in this instance, there are a number of prohibitions a number of exemptions which are provided, but those exemptions are not intended to allow persons to be out in the public generally, but intended only to facilitate certain important transactions within the community, while at the same time not exposing the community to risks or unnecessary risks. The curfew order is essentially seeking to advocate certain policy considerations of government. The first one is that COVID is a serious problem. We have seen the spread of COVID in Dominica in a relatively short time over the recent past, and the curfew order goes to the heart of this particular concern. The second policy consideration is that government has a duty to protect the public. Therefore, the curfew measures are necessary. The third policy consideration is that equally important is that you, the members of the public, you have a duty to protect yourself, your family, and the public. Therefore, you should comply fully with the curfew provisions. Your non-compliance does not only affect you, but it also affects the public. So whereas the government does not wish to have a total shutdown of the country, it was never the intention of the curfew provisions. On the other hand, however, you as the members of the public, you have an obligation and a duty to protect the public itself. So essentially, I would suggest, therefore, that if a person does not have a justifiable reason to be out in the public and justifiable as contained in the curfew provisions, then one should remain home during the curfew period, as your being out in public provides a risk to yourself and to others in the public as well. Thank you, and do remain safe during this period.
Thank you so much to Mr. Lennox Lawrence, who is the Acting Attorney General. And finally, this evening, we welcome the Honorable Ian Douglas, Minister for Trade.
Thank you very much. The Dominica Export-Import Agency, DEXIA, announces the reopening of the Roseau Market on Monday, the 9th August 2021 at 8 a.m. The market will remain open until 3 p.m. Monday to Friday for the duration of the curfew period. Farmers are advised to vend their produce during the weekdays. Vending will also be allowed along the Dame Eugenia Charles Boulevard, the Bayfront, under the management of DEXIA. All produce should remain aboard vehicles. The agency took the decision to close the Roseau Market due to the rapid increase in COVID-19 positive cases in Dominica and the threat of overcrowding, which could lead to further spread of the virus. DEXIA recognizes the importance of the market to the livelihoods of the country's farmers and will reopen under the strictest guidelines to ensure the safety of vendors and patrons. The wearing of masks is mandatory by law and shall be enforced fully. Vendors and customers are further advised that all protocols must be adhered to, including physical distancing, hand hygiene, and respiratory etiquette. To minimize crowding, vendors are further encouraged to sell their produce at the respective community markets or at individual stalls in their communities. Thank you.
We'd like to thank the Honorable Minister for Trade, Honorable Ian Douglas, for his presentation this evening. Ladies and gentlemen, in essence, what we've been asking you to do is comply. Comply and adhere to the protocols as much as possible as we continue in this fight against COVID-19. We thank all our presenters. We thank the media partners this evening, as always, for making this broadcast possible. And we wish everyone a safe evening as, again, you are still under lockdown protocols. We invite you, as always, if you have any questions, any concerns about COVID-19, to call the hotline. The COVID hotline. If you feel any symptoms, do not visit your health center or the hospital, but call the COVID hotline for further instructions. Again, thank you to all and have a good evening.